So this is a 69-year-old male with chronic pain in the right elbow. He's had about 2 or 3 cortisone injections into the common extensor tendon, which unfortunately helped him only temporarily. He had an MRI which showed a fairly large partial intrasubstance tear of the common extensor tendon with significant thickening. We went ahead and did an ultrasound-guided platelet-rich plasma injection. During this procedure, he found it quite uncomfortable, and I think we were not able to get the needle exactly into the defect during this procedure. If we had to do this procedure again, I would opt to have the needle go right into the defect, more proximal and superficial to where it was during this procedure. So here's a diagnostic ultrasound of a fairly sizable intrasubstance tear of the common extensor tendon, which the patient has been plagued with for several months or up to a year perhaps. Ultrasound findings does show this very large intrasubstance tear at the origin of the common extensor tendon. He previously had several cortisone injections in this region of the tendon to relieve his pain. And here you can see the coronal MRI showing pretty significant involvement, thickening intrasubstance tear of that common extensor tendon, and it correlates very well with his ultrasound. You can compare it on ultrasound to his normal elbow, which has a marked difference. So here we are, we're starting the procedure. You can see the needle essentially right above the radial head. We want to get the needle into that region of swelling and partial tearing. And in this case, the needle seemed a little bit distal to where ultimately I wanted it to go, but I did see spread of the PRP into the region where he has tendinosis and partial tearing. And here we are, we're advancing the needle a little bit further, basically to the distal end of this tendinotic region. And we're continuing to inject PRP. And here you can see PRP basically filling in some of the defects within that common extensor tendon. Ideally, in this case, I would have liked to see the needle a little bit more superficial and a little bit more proximal towards the origin of that common extensor tendon.